Now, to continue this conversation is the senator from Louisiana, Senator John Kennedy. Senator, it's great to see you. Thank you for being with us here today. Why? Why did we shut down the government?
Well, I want to be careful, Will. I don't want to do anything to upset our agreement. If I did that, my colleagues would, I don't know, they'd have Katie Porter slap me to Pluto, and I couldn't blame them. Look, Senator Schumer chose to have this shutdown. And it's clear, it was clear at the time, it's clear now. He just dug up more snakes than he could kill. His demands were unreasonable. They were so unreasonable that they weren't even within the realm of possibility on my side of the aisle. And we were prepared to just sit there as much as it hurt. I mean, we didn't have a choice. We couldn't possibly do what Senator Schumer wanted us to do. But look, I want to thank the Democrats who finally said, look, enough of this foolishness. We're going to open government up. My only disappointment in the deal that we have, I strongly wanted a provision added that senators cannot be paid during a shutdown. It's called shared sacrifice. It's called leadership. We were getting paid, but our staff wasn't. I didn't take my salary, but our staff wasn't getting paid, and air traffic controllers and our military. I thought it was the height of hypocrisy. Now, my leadership blocked me from bringing that bill, but I'm not going to stop. I'm going to keep coming.
Shared sacrifice. If I asked that same question to Democrats, Senator Kennedy, why did you shut the government down? I would undoubtedly get an answer that revolved around the extension of Obamacare subsidies, or maybe even more generically, something about the rising price of health care. Now, while I have just laid out why health care prices rise, there is no doubt it resonates with everyone watching, with voters. It's arguably what brought Zohran Mamdani into power as the next mayor of New York City. So what is the answer from Republicans? How can you address affordability when it comes back, apparently in about a month? How will you debate? What will you say to the voters about the rising price of health care?
Well, here's what I'll say, Will. I'll say if we learned anything through this intergalactic freak show shutdown, we learned that Obamacare is not working. We were promised if we did it, premiums would go down and insurance would be more accessible. It's been neither. We were promised our lives would be better. Our lives are worse. We need to fix it. Just extending the status quo is like putting fresh paint on rotten wood. Now, how are we going to fix it? Well, we're going to vote on revising Obamacare exchanges here before Christmas. We need to put together a proposal that looks like somebody designed it on purpose. But longer term, to the larger issue, health care is part of affordability. What the Senate needs to do is get up off its ice-cold, lazy butt and do another reconciliation bill.
Affordable. Accessible. Two words politicians love to say and Americans are still waiting to feel. The government shut down, families worried, workers went unpaid, and once again, Washington proved how disconnected it can be from everyday life. So why did it happen? And what comes next? Joining the conversation is Senator John Kennedy of Louisiana.
The question is simple, but the answer isn't. Why did the government shut down?
The blame game starts fast.
According to Senator Kennedy, this shutdown wasn't an accident. It was a choice driven by demands so unrealistic they never had a chance of passing.
Painful? Yes.
Avoidable, according to him, no.
Eventually, cooler heads prevailed. Enough was enough. The government reopened, and credit was given where it was due Democrats who stepped back from the brink. But one issue still burns. Lawmakers kept getting paid. Staff didn't. Neither did air traffic controllers. Neither did the military.
That, Kennedy argues, is hypocrisy at its finest. Shared sacrifice shouldn't be a slogan, it should be policy.
But the shutdown wasn't really the end of the story. It was the opening act. Because beneath it all is the issue voters feel every single day: the cost of living. Healthcare sits at the center of the affordability crisis. Premiums were supposed to drop, access was supposed to expand, life was supposed to get easier. Instead, Americans are paying more for less. Extending what already isn't working isn't reform. It's repainting rotten wood and pretending the house is solid. The message here is blunt.
The system needs fixing, not patching.
The plan: revisions, reconciliation, legislation that doesn't stall for 60 votes but moves forward with 51, healthcare reform before Christmas, and bigger affordability reforms after the holidays. Because healthcare is only one piece of the puzzle. Food costs more, housing costs more, regulations pile up, and everything costs more. The pressure is everywhere, and voters know it.
Now, how are we going to fix it? Well, we're going to vote on revising Obamacare exchanges here before Christmas. We need to put together a proposal that looks like somebody designed it on purpose. But longer term, to the larger issue, health care is part of affordability. What the Senate needs to do is get up off its ice-cold, lazy butt and do another reconciliation bill. We don't need support of our Democratic colleagues to do that. We can do it with all Republicans. I think we did an extraordinary job with the one big beautiful bill, but under the law we have the authority to do two more. We haven't done anything since the one big beautiful bill. After the holidays, we need to get serious, and in a new reconciliation bill, we need to address the cost of food, the cost of health care, the cost of housing, the cost of regulation. Regulation of goods and services makes all of our goods and services cost more. And the Senate needs to rise to the occasion and do something.
Well, there is no doubt the voters have real questions, real concerns about affordability. It'll be interesting to hear what those answers will be from Republicans. And just as a reminder to everybody watching, if it's done through reconciliation, it will only require 51 votes, not the debate we've had over the government shutdown of 60 senators in the United States Senate. Senator Kennedy, always good to see you. Thank you.
The argument is clear. The Senate can't sit still. It can't wait. And it can't hide behind procedure while families feel squeezed from every direction.
This isn't just about a shutdown, it's about affordability, accessibility, and whether Washington can still respond to real life, because the debate is coming back, and this time, the voters are watching closely.